Hi, my name is Arshia Soni, and today we're going to be reviewing the main points from our interview with Dr. Biju Paulos, talking about risk factors, symptoms, and treatment options related to schizophrenia.
My name is Liana Thurthil, and basically, schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. From our interview with Dr. Biju, we learned that there are three main symptoms with schizophrenia. One is positive symptoms that get added onto, and these symptoms could be treated easily. The next symptom is negative symptoms, and these symptoms are like stuff that gets subtracted off from your personality, and for this you need medications and antipsychotics. The third symptom is cognitive symptoms, and all these symptoms could lead to stuff that would disrupt daily functioning and quality of life, which could include hallucinations, disorganized thinking or speech, and might involve a lack of motivation, reduced emotional expression, social withdrawal, and difficulty in experiencing pleasure.
The topic that we want to acknowledge in our time speaking is how protective factors such as self-care and being in a better environment can help people with schizophrenia. Some of the positive factors some of the positive things that we could do to help encourage a positive environment for schizophrenic patients is firstly giving them enough space, especially in public places like their own place to speak and talk and to recuperate their thoughts. As a schizophrenic person, people get overwhelmed about the things going around in their environment, and having their own time and place to recuperate their own thoughts can help them a lot. Also, a main thing that we discussed is incorporating schizophrenia and other mental health illnesses within school curriculum. Educating people can help get rid of any misunderstandings or negative assumptions about people. By doing this, we can also make sure that more and more people are more empathetic towards anyone with schizophrenia or any other mental health illness. First question we covered is how doctors are able to support managing their symptoms and improving their quality of life. As earlier we mentioned, for positive symptoms, these can be treated with psychotherapy, which could be anything from doing deep, intense thoughts to just normal therapy with a therapist. Both of these things are very helpful to people who are going through positive symptoms because these are able to manage and bring down what has added to their personality. When we get it closer and look deeper into negative symptoms, which things are subtracted from their personality, we need to treat them with medications because things that are subtracted from your personality aren't able to come back with things such as therapy. Being able to do this can also help them encourage their behavior as a person. But the only downside to having negative symptoms and needing to take antipsychotics is that it can increase things such as anxiety. And finally, our cognitive symptoms could be things such as seeing things when you have hallucinations and things related in that ballpark.
The second question that we asked Dr. Biju is, what are the biggest challenges for patients living with schizophrenia? Schizophrenic patients have many symptoms, as we've covered before, including hallucinations, disorganized thinking or speech, and that could involve a lack of motivation, reduced emotional expression, social withdrawal, and difficulty in experiencing pleasure. A lot of schizophrenic patients have a hard time socializing with people, and this can affect their daily lives because humans are social creatures, and it's important that we talk to others about our problems and stuff.
As Liana mentioned earlier, humans are very social creatures, so being able to express our thoughts and emotions will keep us from being enclosed with our own thoughts. This is why people go through things such as therapy to help them release their thoughts and emotions. But the difficult thing is that schizophrenics have a hard time expressing these emotions, which may make them overwhelmed with their thoughts and not able to say anything, which is why schizophrenics may have things such as psychotic breaks when all of their emotions release at one time and they run away or things like that. This is why we should support schizophrenics going into therapy, but also not being too overbearing, because a lot of times schizophrenics don't even think they're schizophrenic, which leads us to one of our main problems, schizophrenics actually going to therapy to get their proper treatment in the first place.
The third question we asked Dr. Biju is, how do you think society can better understand and reduce the stigma surrounding schizophrenia? A lot of people don't understand that mental health is health. There's an analogy, imagine a person is having a stroke. Then obviously you'd go to the hospital to see them, you'll say your regards, and you'll help them. But if a person has depression and they're just laying around, people would call them lazy. This is a problem that we have to fix in society. Schizophrenic patients should be treated just as a person with a physical illness.
Another way we can reduce the stigma surrounding schizophrenia is by incorporating it into school curriculums. By doing this, we are able to educate the student population on why schizophrenics may act in certain ways, whether that be a psychotic break, being very anxious in public places, or other things like that. Schizophrenia is a neurological disorder, meaning that there are certain neurological passageways that don't act as well, which is what causes them to have hallucinations. Just like in any physical disorder, they're not able to do it and don't possess it in the first place. Rather than quote-unquote lacking it, they're not born with it to begin with. So being able to understand this and treat them with sympathy will be able to further improve our stigma surrounding schizophrenia. The fourth question we covered is what misconceptions about schizophrenia or mental health as an overall topic you encounter most frequently. The first thing we encountered is that it's really easy to get over mental health. People think of depression as just being lazy and sad, or as anxiety, just being scared to talk to people, for example, such as in social anxiety. These things are things that are affected by our neurological passageways and are really hard to recover on their own. Only with things such as antidepressants or treatment or things like therapy are people able to move past the mental health disorders that they get. For example, post-traumatic stress disorder is one of the very serious mental health disorders that people face with due to past experiences that they've had. Being able to get over this takes a lot of therapy, time, treatment of their coinciding mental health disorders such as anxiety or depression, and moving past that and making peace with their past. For example, in schizophrenia, some coinciding mental health disorders are anxiety or depression. Being able to not only battle schizophrenia, but get over these other coinciding mental health disorders such as anxiety, depression can take so much time. Being able to get the right resources, going through therapy, making peace with their past, and moving forward takes years, and people should be patient in how they respond.
Another thing we discussed is how mental health is actually a disorder of the brain. It's not the mind, it's the brain, and it's also another physical thing that can affect you. While having a heart attack or a stroke is also a physical thing that can happen to your heart or something, mental health is something that affects your brain organ, which tugs along your emotions and which could cause all these symptoms such as depression and anxiety.
The fifth question we covered is what role does psychotherapy play in the treatment of schizophrenia? As we mentioned earlier, psychotherapy is what helps patients go through with their positive symptoms. Symptoms added such as facing hallucinations and dealing with the fake thoughts that they've been having can help them understand and better get a grasp of the world that is around them. Being able to deal with the fact that they've been experiencing hallucinations and setting those away from reality will help patients better further their experience and their perception of reality. Making sure that patients get psychotherapy is a very vital role in patients with schizophrenia because without it, they won't be able to distinguish what happens within their hallucinations and real life, which can help them make decisions that weren't originally made or aren't logical within the sense without their hallucinations happening in the first place.
The sixth question we acknowledged is what advice would you give to someone with schizophrenia? Well, supporting a family member with schizophrenia can be really challenging, but some ways you can help yourself is by educating yourself and learning about the symptoms of schizophrenia and treatment options. Understanding the condition can help you respond appropriately and empathetically. And the second way you can help them is by encouraging treatment. Support your loved one in seeking a professional help, including medication and therapy, and remind them that treatment could improve their quality of life. The third way you can help them is to listen and help them communicate. Be open to listening to them without judging them. Encourage them to share their feelings and experiences and validate their emotions. The fourth way is to establish boundaries. Maintain healthy boundaries for your own well-being and for their own well-being. People with schizophrenia have a lot of deep thoughts, and I'm sure they'd want their personal space. And it's important to take care of yourself while providing support too. The fifth way is to be patient and remember that recovery takes a long time and that schizophrenia isn't a small thing and it takes a while to help them.